Thank you for the generous introduction, and it's nice to be following Louise's presentation. I first started my practice in Scarborough. Actually, I've been working between Scarborough and Durham since graduating, and kind of lived in both places most of my life. And I remember first using the Scope service in Scarborough, and that was maybe 10 years or so before we were just able to get it launched now in Durham region, and it was a big help. And so I remember when I was using it in Scarborough, I felt really, because I was practicing in both places, I actually felt kind of bad that we didn't have it to help all the Durham patients. And so it's really nice that we have that service now, in both areas, including Durham. So my presentation today, the first part of my essentially my presentation today in a nutshell is really about finding efficiencies in our practice to help with, saving time, reducing burnout, increasing our reach, increasing the throughput for patient care. And so the first part of the presentation is kind of taking a stab at that, looking at one of the sort of more important but mundane tasks, which is preventative screening. And then the second part of the presentation is just looking in general at how we can look at a combination of our practice, using some automation tools, let's say, upskilling our staff, and also taking advantage of some of the resources we have in our community to help, again, increase our breadth and sort of access the full breadth of the patient's medical home, including things like the SCOPE program and other programs like that. So that's it in a nutshell. And, since my presentation is about efficiency, I'm going to try my best to kind of speed through it and not kind of belabor too much. All right, let's see now. All right, so in terms of conflict of interest disclosures, I'm not receiving any payments or honorariums for today's presentation. I do work as a medical director for Rosslyn Diagnostic Clinic, which performs some of the preventative health diagnostic screenings, which will be mentioned today. And I do have a small share in one EMR automation tool called Wave. But in today's presentation, I won't really be mentioning them exclusively. It'll just be kind of a full chart of all the different tools that can be used. So it's very agnostic in that sense. And some of the acknowledgements I'd like to give a shout out to for some of the people I reached out to give me some feedback on some of the things they use in their practice today. So some of the doctors' names are mentioned. Like I mentioned, the first part of my presentation is really about preventative care. And right now, preventative care tends to be inconsistent, reactive, and time-consuming. And a lot of the metrics from whether it's osteoporosis screening, whether it's AAA screening, mammogram screening, it's pretty clear that we're kind of below target for many of these different things. And we can kind of brainstorm, and I'm sure we all know some reasons why it can be challenging to manage all of these. So there tends to be a lot of sort of missed opportunities. There's a lot of manual work that needs to be done, and really, when it comes to, a lot of times we end up having to face sort of the more acute things. And we're just busy trying to put out fires, so to speak. And so a lot of these things kind of fall to the wayside. And we're trying to rely on manual or relying on our memory, things like that, to try and bring these things up with patients each time they're there. And kind of looking at it opportunistically tends to not, lead to good outcomes. And so just trying to take a shift at that might make things a lot more easier and more efficient. So really the objective is to not work harder, but try to build the infrastructure that ensures no patient falls through the cracks without demanding more of an already stretched physician workforce. And in addition to this, I'd like to add, as we know, because in Durham region, we do have a significant amount of the population comes from minority backgrounds. And especially when it comes to preventative healthcare, there's also a huge gap in terms of health literacy. So that also can tend to lead to huge gaps in terms of which patients end up getting the correct preventative care and get the mammograms on time to get that breast cancer diagnosed versus another patient who might not have that health literacy and ends up being diagnosed quite late and ends up having much more worse outcomes. So this is where we have an opportunity to really try to make it as easy to not miss screenings while also not taking on a lot of extra work and scaling things. Um, the three ways I think that or the three strategies to try to make preventative care more efficient. One would be to try to make it more efficient to identify patients that need to be screened. So really using the EMR and the population level queries and searches that can be done to try to pull out lists for each type of preventative health screening, whether it's pap tests, whether it's vaccinations that need to be done, whether it's for osteoporosis, things like that. And then number two is to try to build an automated way to make use of those queries that are generated to reach out to patients and to build that system to kind of onboard them onto a pathway that makes sure that the things that they need get actioned on. And then number three is to delegate the right team members and community partners with different tools, whether it's education, upskilling, standardized orders, and defined protocols to action on them. So the first step is to identify, so turning your EMR into a population health tool. So this is really learning how to leverage the search queries and other tools that are built in that can find opportunities to easily identify patients that can benefit from different screening. And so, just some examples. So as I mentioned before, like cervical cancer, mammography if needed. If some patients have, the good thing is now patients can self-identify and self-refer for mammography, which is really helpful through the Ontario Breast Screening Program. But it might still be good to, have a tool that can identify whether patients have actually done it and maybe help kind of nudge the ones that might have not. And then some other ones like AAA is a new one that the province has also kind of brought to the radar. And I think, I'm not sure as yet if it's still available, if they're going to also move towards self-referral as well. I'm not sure if it's happened yet as yet, but they've sent out letters. So a lot of patients might have been coming to been coming to you asking for what this is and what to do about it because they got that letter, and so you kind of have to act on it. And then again, routine and age appropriate vaccinations as well. And that also helps because there are some not only for seniors but even for school age children. A lot of them might receive suspensions from school and things like that. So to be sort of on top of it and proactive sometimes can help instead of having calls from 50 worried patients and their parents saying that they're going to get suspended next week if they don't come and get their vaccines. So really, the way to kind of get that identification done is to really use the EMR capabilities. Some examples are building advanced search queries, custom patient lists, preventative dashboards, and even monthly automated reports. So that way, and this is also for follow-ups too. So you might have done a pap test today and they need another one, let's say in 2 years, or depending on what the results are, maybe it was indeterminate, you need to do another one, let's say 6 months or whatever the case may be. So, making sure that you can quickly add those reminders in there so that it is not left to your memory or the patient's memory, and those can be acted upon. And then just having a strong team that you can assign those to make sure that someone is actioning on them, and it's not necessarily, that's not yourself. So step two is automation and removing yourself from those repetitive tasks. So building a workflow where once you have those lists generated, you can create an automated system through phone calls, text messages, emails, things that are also built into the EMR that can also reach out and and act on your behalf, to educate the patient about what needs to be done next, or whatever, if they need to come back in to see you, or go somewhere for a test, or get, let's say, a fit test delivered to their home. Um, so, and then in terms of uh, some of the tools, um, so there's a whole new sort of slew of a whole sort of industry of what's called like EMR integrators. So a lot of EMRs themselves can do maybe like 70% of the work that you would need to kind of function and get things done. But now there's all these extra things that are sort of add-ons that can really supercharge your EMRs. So on the left here, there's just a bunch of different categories of some of the different items that can be done. So for example, obviously AI scribe and documentation is a big one. There's also AI secretary and clinical assistants that can now help, like even believe it or not, like patients can call and speak to an AI assistant to try to do most of the booking and rescheduling and things like that. There's inbox and fax triage AI. So whenever lab results come in, you no longer need to have an admin staff actually code them and move them into the patient's chart. It's sort of done automatically. Automated task managers. So, for example, if you have, let's say you do screening, pap tests, or anything like that, or AAA screening or whatever, and majority of them might come back normal, and neither you nor your staff would be, use good use of their time to call them to tell them it's normal, but the patient does need to know. So, for example, either Felix or Wave or any of these other tools that can kind of accomplish the same thing, you just kind of right click on the result, and you can have sort of recorded messages. It could be with your voice or just standard saying, hi, so and so, this is Dr. Firmly. Just want to let you know that your test for AAA screening was normal. No action is needed. In case you would like have any questions or would like to book a follow up, you reach us at this link, or book an appointment to discuss, and that can all be done sort of automatically. Patient appointment automation. So again, there's a lot of tools now where you can kind of generate a bunch of different types of appointments and send it out. So for example, if you want to do sort of a mass pap screening kind of campaign, you can create whether you want 15 minutes for a pap or 10 minutes or 20 minutes. You can create those appointments, any instructions you want already, and it's all automated. The patient just clicks on that link. And if you want it with yourself, if you have a nurse that's you've designated, a nurse practitioner, that can all be done through there. Same with vaccines, same with everything else. Preventative recall automation, clinical decision support, referral automation, and pre-visit planning. So those are like, for example, history taking, or even uh, intake questionnaires. So before patients need to come to see you, they can fill these out. So a lot of the SOAP note that you already need is already kind of pre-prepared for you, and also gives you an idea before you even walk in the room, kind of what you'll be dealing with. In terms of finding the right tools, we had a phenomenal presentation last month, so I don't want to delve too much into that. And in fact, I think one of the plans is to all of these recorded presentations to have them recorded and then have them available. So I'd definitely recommend that presentation. And this is just some of the contact info. So Ontario MD is run by the OMA, and they have a few different services within there that can help with finding the right tools for you based on your needs. And sometimes they even vet some of the products, like for example the AI scribes. And so I would definitely recommend to use that tool to kind of help you choose the right tools. And then number three is the execution. So once you've identified, you figured out your search tactics, you figured out the automation side. The last thing is to execute. And this is where you have your sort of action team or protocol in terms of how you want each of the different types of preventative health screening sort of dealt with. So it could be different for cervical cancer, for vaccines, osteoporosis screening, AAA, um, and so some examples of how you could tackle that would be assigning different roles to each member of your team based on their education, what they're comfortable with, and sort of what you've trained them on. So, for example, the admin could really look after the patient outreach, the appointment booking, the recall tracking, and list management. The nurses can help with some of the procedures that need to be done, such as pap tests, vaccinations, patient education, and even triaging the results for you, especially like the normal ones, but even the abnormal ones, they can at least kind of get the process started on what the next steps might be. And for you as a physician will be sort of the protocol design, the oversight, and the complex cases. Um, and again, this is really, again, just really the task stratification and um, trying to match the right task to the right role. Um, And then I guess we'll be talking more about this in the next presentation, but um, really using partnerships, leveraging partnerships, and um, expanding your capacity could be really helpful. So, for example, as you know now, for example, pharmacists are able to administer vaccines, and there might be a lot of the vaccines that we get in primary care might be from the public health stock. So those ones might make more sense for us to do. But there might be a lot of vaccines that are there they might not be eligible for the public stock. Like for example, like shingles is indicated for those age 50 and above, whereas the public health might only cover it for, let's say, 60 to 65 or a different range. But it might be beneficial to, for example, partner with a pharmacy you're comfortable or that's accessible for your patients, and just ask the pharmacist if they're comfortable with helping with taking care of all the administrative side of, let's say, helping patients get the best prices if they have to pay out of pocket for certain vaccines, and then administering them, and then also sending you all the proof of vaccination so that your records could be updated. So that might be a good sort of partnership to consider. Same with diagnostic clinics. So, you could find again a diagnostic clinic or a few that might be accessible for your patients, and speak to them and say, hey, look, I might have 100 patients that meet the criteria for AAA. Can I give you a standardized requisition or a standing order, and give you the list, and you can connect with them to book the appointments for them, and send us, make sure that we get the results. And in fact, at the clinic that I work at, what we did was we also tried to find specialists that were willing to act on those results, so that in case a patient does show that they're positive for screening for AAA, then they can see a vascular surgeon to optimize and see whether or not they would need surgery or further follow-up. And same thing, for example, for bone densities, we were able to partner with a local rheumatologist who comes in-house, let's say, and any patients who are positive for moderate or high risk for fracture, we would just automatically refer them to the specialist as well. So basically with one standing order or one advanced directive, we're able to kind of substitute hundreds of requisitions and potentially hundreds of referrals as well. So it saves a lot of paperwork for the physicians. And same thing for example, mammography, having a advanced directive so that the clinic, again, OBSP already has, patients can self-refer, but you can even go a step further and work on an advanced directive that might help connect patients directly to the breast assessment center rather than having to generate a new referral each time. Um, all right, and so this slide really talks about um, opportunistic screening. Um, uh, so this slide talks about um, some ways to help with really with patient education, to help them again build their health literacy. So sometimes if patients are waiting in your waiting room, so using signage that talks about different screening opportunities that might be relevant for them, depending on their age and other comorbidities. And also having things like QR codes, patient newsletters, digital intake forms, things like that, that might help also increase rates of preventive health screening and really make your patients a partner with you in their journey. Um, and so this is just an example of, for example, for cervical, if we were to take the case example of cervical cancer screening, like an end-to-end example would be, for example, the EMR would generate a list of patients that are due. Number two, an automated message was sent out either via the patient portal or SMS or email. The patients would then take the message and book in so that would essentially be the call to action. And then number three would be the patient would book, and the admins would help confirm the appointments. And then, you can give an advanced directive or standing order for if you have a nurse at your site that can do all the PAPs for them. And then with respect to results, so normal results would be auto-notified and abnormal results would be escalated based on whatever protocol you put in place. And then you'd also set recalls based on those results in terms of future screening dates, depending on those results, or referral as needed if needs to go to see a obstetric gynecologist or would need colposcopy or some other follow-up. Another example would be related to maybe so like a diagnostic imaging, perhaps case example, for example, like AAA osteoporosis screening, breast cancer screening, and it all sort of follows similar protocol. And then again, workflow number three would be, as I mentioned, the vaccinations that may be needed, especially for those 65 or especially for those patients 50 and above. So essentially, the goal is to kind of move from manual patient tracking, where things might be missed and where there'd be higher administrative burden, to more an EMR-driven automatic and automated workflow where things are caught a lot more easily, and screening is more optimized, and ultimately saves your time and it keeps you happy as in addition to your patients. Um, so just the final takeaway is, preventative care is about design, and should be less about effort. And I think finding the tools that would work for you and in your practice would be really essential. And if you work in a group practice, discussing with your colleagues to try to do something system-wide would also be more efficient as well. And I'm happy to take any questions um, and thoughts, feedback.
So you can put their questions in either the chat or the Q&A, or if you raise your hand, I can unmute you and give you access to a mic, or you might be able to unmute yourself. But there is the opportunity for you to ask a question verbally as well, if anybody's interested. It's a great presentation, Suleiman. Thank you so much. Very thorough, and I think I've often heard physicians describe all the admin burden and everything as, death by 1,000 paper cuts. And I think that's truly fitting. And so this is how you kind of save yourself with all these little things and prevent and protect against that burnout with all these, little steps that you can take. And they all come together and maybe help make things much more efficient in your clinic space. Maybe I'll just ask a question. What would you say out of kind of all of the knowledge you've shared and everything you've suggested, if there was one takeaway or one thing that people can start doing, because sometimes all these tips and tricks can feel fairly overwhelming. If there's just one that made a big difference for you, what might you suggest the starting point would be for somebody who hasn't done any of these things?
I think the first step would be to really just kind of take a step back and maybe sort of, because yeah, it can be pretty overwhelming. So I think the best thing where I would kind of start with, and what actually kind of started me down this journey was finding out what's the biggest pain point for either you, your staff, and your clinic in general, right? So what started me on this journey was I remember when patients would come and see me in the clinic, and they would say, "Oh, I didn't for whatever issue it was," and they said, "Oh, I did my test yesterday. I'd like to review it with you." Um, and I'd go in their chart and I couldn't find their test result, right? And then I'd have to go to the admin and say, "Hey, look, this patient went yesterday, did their test result, and it's not in the chart. Can you help me find out what happened?" And they would say, "Oh, you know what? It's sitting in the pending in the incoming faxes, and it just hasn't been kind of labeled yet." So then they would kind of on the spot go through like hundreds of faxes to find that specific one, and then put it in their chart, and then I'd be able to see it. And that's where the first thing naturally it led me to say, okay, we got to find some automated way to do this, because this is just a very mundane task, and now it's actually causing barriers for patients, that need that made the effort to see me do the test, come back and see me, and I still don't have the result yet. And even though the result is sitting in the EMR. And then from there, it just kind of kept on. So once we tackled that issue with finding an automated way of having all of that done in the inbox, then the next one was, for example, okay, what do we do with like normal results, and how do we save time from the patient for the physician or for the admin staff? Because if you don't call them, then they're going to be calling you every day also and wondering, hey, what happened with that test result? And then it's going to end up wasting more time, right? So, and cause more frustration. So I think that would be, I guess maybe my biggest advice would be to try to see kind of where is the low hanging fruit in your practice, and then sort of implementing maybe one thing at a time. And because that you'll kind of see those returns on your investment sort of like pretty quickly, I would say. And then you kind of get an idea of getting just into the art of looking how to automate, how to scale, and keep saving more and more of your time.
That's great. And there is one question in the chat for you too, Dr. Fermi. So Dr. Jensen says, I struggle with implementing this. Are the people to help walk through these with providers, consultants who help set up the IT steps?
That's a great question, Dr. Jensen. So I did share this one. I'm not sure if I've had some I've had pretty good experiences actually with Ontario MD. The good thing about them is that they have access to all the EMRs. And even when we were trying to implement like a search query, for example, for like AAA or for example osteoporosis, and we told them which EMR, they had somebody, a consultant that actually generated the query and then saved it as a file and sent it to us. And then I just had to open that same file on our EMR, and then it ran the query for us, for example. And so I think that might be a good starting point if you haven't tried them already. And then in addition to that, the other one would be looking at again, if you tackle sort of one issue at a time. Like for example, you can see this kind of chart is a bit overwhelming. There's so many different categories of problems you could solve using different AI tools. And then for each problem, there's maybe 3-4 different solutions. So I would say once you've had a chance to identify which problem you want to tackle first, try to find like 3-4 different vendors that might offer it. And then just book a demo, try to book a demo with them, just to understand like high level how they could solve your problem for you. And then obviously what the cost might be. And then after that, usually these companies and vendors themselves will help sort of integrate it, teach you how to use it, teach your admin staff how to use it. Sometimes these vendors end up being preferred vendors with your EMR, and that might also help too. So for example, Acuro might has their own list of like preferred vendors, same with TELUS, same with Oscar, for example. And so that might be helpful, because then both your EMR provider and that and that sort of service will both have staff that can help you implement it, and they kind of already talk to each other. So that might be something else that might help. And then also peers. So, in our WhatsApp group, in our Germ WhatsApp group, there might be other physicians. I think that's another really good resource. There might be other physicians that have solved that problem for themselves. And so you could reach out and say, hey guys, I have this problem I'm trying to solve. Which IT solution worked best for you guys? And everyone could kind of chime in and say, hey, we use this one. We had good experience. We had, like the other day, and I think Dr. Anne Sorensen was talking about how she wanted to switch from like Oscar to Averos, for example, because of some issues with the HRM. So it's nice to hear real life feedback from other physicians who've already implemented it and have worked with it.
Great. Thanks, Dr. Firmly. I'll just add, so we did have Ontario MD present last month at our education session, and they did say that their at the elbow support is free to physicians. So they're completely funded. I believe it's through the OMA, and so no cost to you, this support is available. So as Dr. Firmly has there, the contact details for that team might be really helpful to get you started looking at those efficiencies within your specific practice.
They also have a peer mentorship support group. So they actually have physicians that are peer mentors, and that are sort of like kind of heavy users who volunteer to help other physicians. And they have some structured groups and then unstructured groups. So like once a month you can meet with them and just kind of express some of any frustrations you might have or any help you might need, and they'll help you with that. So again, it does take some time for sure to get started, but the returns on investment in the long run, especially, hopefully all of us might be practicing for the next maybe 5, 10, 15 years perhaps. And so the returns are really, really, really high in the long run. So that's where that investment might be worth it. And also times are changing, I think also getting into it now, the good thing is that that kind of learning curve is worth going through, because the more tools are available and the more familiar we are with some of them, the easier it is to kind of jump onto opportunities and continue to kind of make our lives as easy as possible. So I'll just stop sharing this one. So Shannon, what are your thoughts? Should we do a break and then jump into the next
I was
one?
thinking we just do a 5-minute quick break. Anybody needs to step out for a bio break, or if Dr. Firmly wants to take a drink of water, give his voice a rest for a few minutes. But we will reconvene at 10 after 10.